Dermatitis herpetiformis is an autoimmune skin condition. Look at this picture, shows that skin rashes, detail going on. Introduction. Dermatitis herpetiformis (DH) is a chronic autoimmune skin condition closely associated with gluten sensitivity. It is characterized by intensely pruritic, blistering skin eruptions, often called the skin manifestation of celiac disease. DH significantly impacts patients' quality of life due to its persistent symptoms. Etymology. The term dermatitis herpetiformis is derived from the Greek word derma, means skin, and the Latin word herpetiformis, meaning resembling herbs, due to its grouped blister like appearance similar to herbs infections. Despite the name, the condition is unrelated to the herpes virus and is an autoimmune disorder. A definition. Dermatitis herpetiformis is a rare chronic skin condition characterized by clusters of itchy blisters and bumps, primarily affecting extensor surfaces such as the elbow, knees, buttocks, and scalp. The condition is caused by an autoimmune response triggered by dietary gluten. Types. 1. Classic DH, characterized by grouped vesicles and erythematous plaques. 2. Atypical DH, presents with non-classical manifestations like widespread eczema like rashes. Causes. DH is primarily caused by an autoimmune response to gluten ingestion in genetically predisposed individuals. This response involves the formation of IgA antibodies that target skin structures leading to blistering. The main causes listed here 1. Genetic predisposition to gluten ingestions. 3. Auto antibodies against transglutamines and epidermal transglutamines. 4. Immune complex deposition in dermal papillae. 5. Cross reactivity between TTG and ETG. Risk factors. 1. Genetic strong association with HLA DQ2 and HLA DQ8 alleles. 2. Celiac disease. Most individuals with DH have or developed celiac disease. 3. Age and gender. More common in adults with slight male predominance. 4. Family history. Increased risk in individuals with family history of DH or celiac disease. Complications. 1. Malabsorption due to associated celiac disease. 2. Nutritional deficiencies secondary to dietary restrictions and malabsorption. 3. Skin infection from persistent scratching and blistering. 4. Increased risk of lymphoma, particularly non-Hodgkin lymphoma in untreated cases. Pathophysiology. Gluten ingestion leads to an immune response in the gut, resulting in the formation of tissue transglutamines antibodies. These antibodies cross react with epidermal transglutamine in the skin. Immune complexes of IgA and ETG deposit in the dermal papilla, triggering an inflammatory response. Neutrophil infiltration and enzymatic damage result in the formation of subepidermal blisters. The pathophysiology of DH involves a cascade of immune mediated events. Here is a step by step explanation. 1. Genetic predisposition. Second step, dietary gluten ingestion. 3. Immune activation in the gut. 4. Cross reactivity and antibody production. 5. Immune complex deposition. 6. Complement activation. 7. Neutrophil infiltration, 8. Blister formation, 9. Clinical manifestations. The damage and inflammation manifest as intensely pruritic, itchy, grooved vesicles and papules on the skin, particularly on extensor surfaces like elbow, knees, buttocks and scalp. 10. Resolution with gluten-free diet. A strict gluten-free diet reduces the production of gliadin specific and TTG specific antibodies. Signs and symptoms. 1. Intense itching and burning sensations. 2. Symmetrical distribution of maculovascular lesions. 3. Chronic or recurrent blistering on elbows, knees, buttocks and scalp. 4. Scarring and pigmentation changes in chronic cases. Diagnosis. 1. Clinical examinations. Assessment of characteristics rash and itching. 2. Skin biopsy. Direct immunofluorescence to detect granular IgA deposits in dermal papillae. 3. Serological tests. Detection of anti-TTG and anti-endomysial antibodies. 4. Dietary history. Evaluating gluten intake. 5. Genetic testing. Identifying HLA DQ2, DQ8 in uncertain cases. Nursing diagnosis. 1. Impaired skin integrity related to blistering and itching. 2. Risk of infection related to open lesions. 3. Imbalanced nutrition related to gluten intolerance. 4. Disturbed body image related to visible skin lesions. 5. Anxiety related to chronic disease management. Management. Disease management. First, medical management. 1. Dietary modification, strict gluten-free diet. 2. Medications. Dapsone provides rapid symptom relief by reducing inflammation. Sulfapyridine or other sulfonase alternatives if dapsone is contraindicated. 3. Management of associated celiac disease. Monitoring nutritional deficiencies. Nursing management. 1. Educating the patient about gluten-free diet and its importance. 2. monitoring for side effects of medications like depson, example, hemolysis. 3. Promoting skin integrity through appropriate hygiene and topical care. 4. Managing pruritus with antihistamines or cool compression. 5. Psychological support to address emotional stress and compliance challenges. Treatment options. 1. Primary treatment. Lifelong adherence to a gluten free diet. 2. Symptomatic relief. Dapsone and antihistamines. 3. Monitoring. Regular follow up to check for complications like anemia, osteoporosis, and lymphoma. Psychosocial medicine. 1. Counseling and support groups to cope with dietary restriction and social challenges. 2. Stress management techniques such as mindfulness and relaxation exercises. 3. Patient education, clear instructions about gluten free living. 4. Family involvement, including family in dietary planning and emotional support. 5. Access to resources, information on gluten free products and recipes. Prevention. 1. Early diagnosis and strict adherence to a gluten free diet in high risk individuals. 2. Regular screening for at risk populations, example first degree relatives of celiac disease patients. 3. Avoidance of cross contamination in food preparation. In conclusion, dermatitis herpetiformis is a chronic condition that significantly impacts quality of life. With proper diagnosis, adherence to a gluten free diet, and medical management, can achieve symptom control and prevent complications. Ongoing education and psychosocial support are crucial for holistic care and long term well being. Thank you. Have a nice day.